This bulletin is coming to you live from the news app here at this Sawick, and on Facebook we're live on TV3 Ghana and on DSTV channel 279. My name is George Quinn. Top of the stories this hour. President John Mahama justifies 1% new petroleum levy, saying it is hard but necessary. And strike by nurses across the country enters its second day today with patients feeling the harsh effects. Also coming up this morning, Bank of Ghana's year-end target of 11.9% seems feasible as inflation plummets to three-year low at 18.4% in May. We have details of these stories and many more coming up in the next 20 minutes. If you spend your time with me, you can also get interactive with us. We are live on Facebook. It's TV3 Ghana. Let's begin from the presidency. As President John Mahama has defended government's decision to introduce a one-cedi levy on petroleum products, describing it as difficult but necessary in stabilizing the economy. Parliament on Monday passed a new law that imposed a levy of 1 Ghana cedi on every litre of fuel. Receiving the report of the National Economic Dialogue, the president expressed optimism that Ghanaians will appreciate the broader intent behind the move. Take a listen.
Recognizes growing energy sector liabilities as the greatest existential threat to fiscal consolidation and macroeconomic stability. Our energy sector carries a debt burden of over $3.1 billion US, with an estimated $1.8 billion US more required to finance fuel procurements for uninterrupted thermal power generation in the coming months. If left unaddressed, this situation significantly threatens national productivity and industrial growth. While we have devised a strategy to liquidate this debt and staunch the bleeding in the power sector, we must take advantage of recent gains created by appreciation in the value of our currency to accelerate the solution to our energy sector challenges. In line with the dialogue's recommendation to boldly tackle the crisis in the energy sector, Parliament yesterday approved an amendment to the Energy Sector Levies Act and a certificate of urgency, introducing a 1 Ghana cedi increase in the energy sector recovery levy. This decision, though difficult, is necessary and justifiable. The additional revenue projected is 5.7 billion cedis annually. This revenue will be strictly ring-fenced to pay down legacy energy debt, finance ongoing fuel purchase, and avert the risk of recurring power shortages. Funds from this levy will not be subject to the hazards of the consolidated fund. And the minister is here. I know when money falls into the consolidated fund, it faces certain hazards. It will not be subject to the hazards of the consolidated fund. The fund will be regularly audited and audit reports made public to ensure its transparent use. While initially much of this revenue will go into the purchase of fuel to ensure stable supply of electricity, with the ongoing developments in the upstream sector, we expect to receive more gas from our ENI Sankofa and Jubilee and 10 fields. With also the assurance of additional gas through the West African gas pipeline, we expect to substantially reduce the use of liquid fuels in our energy mix. At that stage, the resources generated by this increased levy will be channeled to pay down accumulated legacy debts in the power sector. With the recent gains in macro stability and strengthening of the Ghanaian cedi, this levy is not expected to result in any immediate fuel price increases at the pump. We are fully aware of the burden this will place on households and businesses, but I want to assure Ghanaians that this decision was not taken lightly. Furthermore, the government will continue working to reduce systemic inefficiencies in the energy procurement and distribution sectors, while enhancing targeted social interventions for vulnerable groups.
And now the Energy Minister, John Japo, says the new levy is aimed at supporting the effort of reducing the debts of the power sector and not just ECG alone.
Even if you improve ECG's efficiencies 100%, you will still need revenue from external sources to procure liquid fuel. because the liquid fuels have not been factored in the price build-up by the PURC. And so, yes, we have to continue to improve ECG. We have to continue to bring about efficiency at the distribution level, which is ECG. But the bottom line is that even if you improve ECG 100%, you need this revenue. And if you add these revenues now to the bill, you are talking of about 48 to 50% increase. So clearly, at this moment, given the situation that we find ourselves, Cabinet is convinced and government is convinced that this interim measure is necessary so that we continue to find solutions in the long term to the challenges.
Well, according to the president, the decision was not taken lightly in coming up with this 1%, 1 CD increment. And let's know what you make of this. We are active on Facebook as TV3 Ghana. Engage us with your comments and opinions. And now to the health. Across public hospitals in Ghana, a nationwide nurses' strike is taking a heavy toll on healthcare delivery. From major referral centers to smaller facilities like the Adabraka Polyclinic, nurses have vacated their posts, leaving patients stranded, unattended to, and in some cases in serious pain. Here's a report by my colleague, Godwin Asiriba.
OPD for so almost so I was saying
38-year-old Zila Okine is 9 months pregnant and battling severe stomach pain. She journeyed from Teshi to the Adabraka Polyclinic, desperately seeking medical care. But upon arrival, she met a painful reality. The facility was almost deserted. Nurses, who would have typically been the first point of contact, were nowhere to be found.
Maybe antenatal. Baby by will be any honomo, and I'm anti information be as we say, baby. Say, ever coso, till say my baby home.
Her hopes of finding relief were dashed. Tears welled up in her eyes as the pain grew worse, with no one immediately available to help.
Fitty and run my run is a basin, so maybe no more in checking, but unfortunately, bedroom animal say no. It will be any animals.
I watched her from afar, clutching her belly, pacing and occasionally sitting in discomfort. It became clear she couldn't wait any longer. I stepped in. After speaking to one of the few staff members present at the maternity ward, Zila was eventually ushered in. But that was not the end of her wait. For nearly 20 minutes, she sat quietly before being processed and directed to a consulting room where a doctor finally attended to her.
They've checked me, but they asked me to come and see the doctor. So I'm in the queue to see the doctor. I feel okay now. Yeah, I feel better now than before.
The question here is, what would have happened if no one had intervened? How many people like Zila are left in pain with no one to speak for them? This is just one of many cases playing out in health facilities across the country. The outpatient department of the Adabraka Polyclinic on a regular day is very busy. But behind me, just as you can see, the place is virtually empty. Nurses here, like many across the country, have abandoned posts as part of the ongoing strike by the Ghana Registered Nurses and Midwives Association. And the impact here is dire. Patients who would typically rely on this facility for basic health care have been left stranded with no medical staff in sight.
It will last as long as government agrees to implement our condition of service. That's it. We have withdrawal of OPD and emergency services. That is from 4th to 8th, and after 8th, that is 9th, we are withdrawing all services, including wards, theaters, and all the hospital facilities. What we are saying is we also need to be taken care of. Is it not sad what you will be at the emergency and government agency, departments, and other ministries will come and government will pay for them, and you, a nurse, a midwife, will be at a hospital when you are sick, common para, you will need to pay for it.
According to them, This is the fourth major strike action by nurses and midwives in less than 6 years. Strikes were recorded in 2018, 2020, 2022, and now in 2025, all centered around unfulfilled agreements, salary arrears, and poor working conditions. In response, the Ministry of Health has issued emergency directives aimed at maintaining essential healthcare services during the strike. A high-level meeting was held earlier this week where the unions presented a unified demand for the implementation of the 2024 collective agreement, which they claim has yet to be honored. The ministry says it is closely monitoring the situation and is working to deploy logistics and support systems to minimize the disruption. But for patients like Zilla Okine, the delay in care is already a heavy burden to bear. As the industrial action continues, thousands of patients are caught in the middle, waiting, hoping, and in some cases suffering. From the Adabraka Polyclinic in Accra, I am Godwin Asidiba reporting.
Let's still stay on health, as Ghana is set to receive mpox vaccines in the country to complement interventions in managing the disease outbreak. Director for Public Health at the Ghana Health Service, Dr. Franklin Siedu-Bekri, during a virtual media engagement, noted that the service is currently in talks with the World Health Organization and the Africa CDC.
Currently, Ghana has recorded 45 cases of mpox in 9 regions, with 2 on admission. 10 out of the cases are children, while the dominance of the disease remains the Greater Accra, Western North, and Western regions. Vaccination is one of the interventions in managing the mpox outbreak. However, a country must first establish its at-risk groups and the trend of infection, which currently qualifies Ghana to receive some vaccines. According to the Director of Public Health at the Ghana Health Service, there is evidence that the disease, which is normally transmitted from animal to human, is now being transmitted from human to human in the country, hence the need for vaccines.
I remember the last outbreak that we had. Though we had 120 cases, we struggled to clearly establish at-risk group. If you don't get a clear at-risk group, then your intervention may not be effective. So for this outbreak, we are as far as possible, we are investigating to be very established that this is the at-risk group, and then we engage them to make sure that it's done. So I'll say it's work in progress. We are engaging WHO and Africa CDC so that we get the vaccines. Somewhere last year, Ghana didn't have any established human-to-human transmission, so we do not qualify. Now that we are having human-to-human transmission, the idea is that we need to be able to identify the clear at-risk group who will benefit from the vaccine.
Several African countries are administering mpox vaccines in response to the ongoing outbreak. The 9 most affected countries receiving majority of the vaccine doses are the Democratic Republic of the Congo, Liberia, South Africa, Rwanda, Central African Republic, Cote d'Ivoire, Uganda, Nigeria, and Kenya.
In more news this morning, the Minister of the Interior, Muntaka Mohammed Mubarak, says the ministry is in tune with all stakeholders and not only limited to customs in the fight against opioids infiltration. He emphasized that in dealing with such menace, not all information can be made public, as it would armor perpetrators to act otherwise. Our campaign is still active. The abuse against opioid, commonly referred to as Red 225, and it's still sweeping through communities, causing destruction to the lives of the youth. And we want to know the current state of infiltration levels in the country. Let's know what exactly stakeholders are doing about this. And so let's hear from the Minister of the Interior, Muntaka Mohammed Mubarak.
Working together has been so useful, and now you've seen that a lot of arrests has been made, and we hope to continue that. And a lot of the things, because they are security in nature, you cannot just put it forward, because when you do that, then you are exposing the effort of the security apparatus. One thing I can assure the nation is that we are up in tax. We are doing the best that we can to make sure that we bring this thing to the minimum, barest minimum. We also know that, rehabilitation is a very key thing in most of the swoop that we are doing. So we are also emphasizing on rehabilitation of some of the guys that have gone to a point where they need to be salvaged. It's not about just arresting and prosecuting them, but it's about rehabilitating them. So all those things we are working in tandem to make sure that at least we keep our communities safe.
And now, let's hear from the Narcotics Control Commission in the person of the Deputy Director General of Enforcement, Control and Elimination.
We have arrested 2 pharmacists so far, one from Western North, one from Greater Accra, and we are going to pounce on most of them. Sometimes what we are about to do for that one, I don't communicate. There's a region that we are striking by close of day. 3 people are going to be arrested because we have the targets already. Yeah, so that's how we do it. We are going to, and for the pharmacists, once we get you, your license is gone. That one, take it. Every now and then we keep calling on the media to help us in this fight because we can't do it alone. I like saying it in a form like it's like one person's hand. It can never cover the face of God. So we need everybody's hands on board. And so I'm grateful that TV3 is on board and they're helping us in this fight. God bless you.
And now the National Intelligence Bureau, the Ghana Standard Authority and the Food and Drugs Authority have conducted a field test of the $350 million worth of suspected cocaine bust in March this year. Stanley Niblo reports that the exercise was conducted in the presence of Her Ladyship Ruby Aite and the suspect and their counsel.
In March this year, TV3 had opportunity to access the storeroom of the National Intelligence Bureau, where some suspected cocaine with street value of $350 million had been kept after personnel from NIB intercepted a tipper truck conveying the consignment to Accra from the Western region. The consignment weighed 3,319.68 kilograms as high-purity cocaine, ranging between 50% and 70% purity. The consignment is believed to have entered the country via sea fishing vessels. 2 suspects, Isaac Kweku and Kenneth Kobina, were initially arrested and arraigned. Today, we are back at the same office, but this time to witness the field testing of the consignment, which has been presented but yet to be adopted into evidence in court. On Wednesday, June 4, 2025, the Accra Criminal Court 1, presided over by Her Ladyship Ruby Aite, the suspect and their counsel, personnel from FDA and Ghana Standard Authority were at the NIB headquarters to witness the field testing of the consignment in court hearing. Cobalt thiocyanate test was used, while cobalt thiocyanate reagent and hydrochloric acid were applied to a sample of the suspected cocaine. A blue result proves positive of the reaction. Samples were further subjected to test through the use of high-performance liquid chromatography and gas chromatography equipment for confirmation. The National Intelligence Bureau has since secured a court order to destroy the consignment on June 20, 2025 at Bondase. A 3rd suspect, Malco Kudofia, has been nabbed. The suspects have been charged for the importation of drugs without lawful authority and engaging in prohibited narcotic business. Meanwhile, 3 other prime suspects, Kellyan Julian Mensah, Jefflin Nkwajo Into, and Charles Hagan, are at large. Stanley Niblew, TV3 News, Accra.
And now let's do some business-related stories. And Ghana's inflation rate has dropped to its lowest level in over 3 years, reaching 18.4% in May. To further reinforce the disinflation trend, government statistician Dr. Alhassan Idrisu encouraged government to maintain its support for macroeconomic policies that will continue to stabilize their local currency.
This marks the 5th consecutive month of decline in inflation rate and is a significant decrease from April's 21.2%, largely easing of prices for food and non-food items such as transport and fuel costs, attributed to the city's remarkable performance. According to the government statistician Dr. Alhassan Idrisu, the overall trajectory shows sustained disinflation.
Headline year-on-year inflation continued to ease, with inflation dropping to 18.4% in May 2025, confirming a continued disinflationary trend, aligning with broader economic stabilization efforts. The data also show general moderation in monthly inflation pressures, simultaneous decline in both the headline and core inflation signals easing price pressures across both general and core consumption baskets.
To further reinforce the disinflation trend, the government statistician encouraged the government to maintain its support for macroeconomic policies that stabilize the city.
Given the 20.1% inflation in health, households should prioritize preventive care and take advantage of the National Health Insurance Scheme benefits to avoid high out-of-pocket expenses. On businesses, since local inflation is easing faster, imported inflation, businesses can reduce cost pressures by sourcing locally. For government, we would like to recommend government to continue supporting the macroeconomic policies that keep the city stable, that reinforces the disinflationary trend.
The improving inflation outlook could pave the way for the central bank to cut interest rate in July 2025.
Well, on that inflation note, we end the morning news. For more news updates, you'd want to log on to our website, s3news.com. And today is one of our production assistants, birthday, Christian Yale, great guy. May God bless you and continue to enlarge all your territories. Thanks for watching. It's always a pleasure coming your way. Have a good morning.
Of love, hope, and perseverance. This is